Hey everyone! Welcome back to your educator. Today, we're talking about something super important: contraception methods and how effective they really are. Whether you're planning for the future or just want to stay informed, this video is packed with everything you need to know. So, let's dive right in. First things first, what is contraception? Contraception, also known as birth control, is any method or device used to prevent pregnancy. Some methods also protect you from sexually transmitted infections, STIs, while others are mainly focused on avoiding unplanned pregnancies. Now let's break down the different types of contraception and see how effective each one really is. Male condom. Worn on the penis. About 98% effective when used perfectly. But with typical use? It's around 85%. Female condom. Goes inside the vagina. Perfect use, 95%, typical use, around 79%. Diaphragm and sponge. Less common. Around 88% effective with typical use. Bonus: these methods also reduce the risk of STIs. Birth control pills. 1 pill a day every day. 91% effective with typical use. Missed a pill? That drops. Patch like saline. Stick it on your skin, change it weekly. About 91% effective. Vaginal ring, like NuvaRing. Placed in the vagina for 3 weeks, then removed for a week. Again 91% effective. Hormonal shot, Depo-Provera. 1 shot every 3 months. 94% effective. These don't protect against STIs, so using a condom alongside is a smart move. These are low maintenance and very effective. Implant, Nexplanon. Inserted under your skin in the arm. Lasts up to 3 years. Over 99% effective. IUD, intrauterine device. Tiny device placed inside the uterus. Copper IUD, no hormones. Works for 10 plus years. 99% effective. Hormonal IUD, lasts 3 to 7 years, depending on type. Also 99% effective. Great option if you don't want to worry about daily or monthly reminders. Oops! Had unprotected sex or birth control failed? Emergency contraception is here. Morning after pill, like Plan B. Best within 72 hours. 89% effective if taken early. Ella, prescription. Effective up to 5 days after. Slightly more reliable than Plan B. Copper IUD. Most effective emergency contraception, over 99% if placed within 5 days. Natural family planning or fertility awareness relies on tracking your cycle. Typical effectiveness, around 76%, but can be over 90% with perfect use and proper education. Note: requires discipline and careful monitoring. Not for everyone. Done having kids or absolutely sure you don't want any? Tubal ligation for women. Also called getting your tubes tied. Permanent. Over 99% effective. Vasectomy for men. Quick, safe, and also over 99% effective. These are generally irreversible. Think carefully before choosing this route. So, how do you choose? Think about these questions. Do you want kids someday or never? Can you remember to take a pill every day? Do you want a method you don't have to think about? Do you want STI protection? Everyone's body and lifestyle are different. Talk to a healthcare provider to find what fits you best. Contraception gives you the power to plan your future your way. Stay informed, stay safe, and always prioritize your health. If you found this video helpful, hit that like button, subscribe to your channel name, and share it with someone who might benefit too. Got questions or want us to cover a specific topic next? Drop a comment below. Thanks for watching, and see you in the next video.